Jack has the skeleton waving. He's good for comic relief.
Oh, yeah. I know where he's at.
This is just a sign-in sheet when you have time.
Okay.
Did the skeleton pass the screening questionnaire? Oh.
No, it was quarantine.
Okay. We're unmuted. The YouTube live stream is going, so whenever we're ready to start.
Okay. So do I need to announce people not being here? We'll roll with it.
We're veterans, right? We've done this before.
I think so. Everybody ready? I'd like to call the meeting to order and announce that all requirements of the Open Meeting Act have been met. I'd like to welcome everybody joining by Zoom or on the YouTube live stream. And in that spirit, since not everyone can observe, I'd like to announce that Ken Rowe is absent, Casey Kilblain is absent, and Jack Allen is observing through Zoom at OSU Medical Center. Item number 2, approval of the minutes of the November 12, 2020 regular board meeting. I'd like to ask if board members have, oops, we need roll call. I got ahead of myself.
Oh, sorry about that.
Roll call.
Bruce Benjamin,
Here.
Michelle Stevens,
Here.
Susanna Gattoni,
Here.
Marshall Snipes.
All right.
Quorum's met.
Quorum is met, and now we can proceed with the meeting. I'd like to ask if the board members have reviewed the minutes from the November meeting. And if they have, the chair will receive a motion for approval.
Make a motion for approval of the minutes.
Okay. Motion for approval.
I second.
Second.
Bruce Benjamin,
Yes.
Michelle Stevens.
Yes.
Susanna Gattoni,
Yes.
Marshall Snipes.
Yes.
All right. I'd like to proceed ahead with the chair's report. And in giving the chair's report, what we have been doing is reviewing portions of the strategic map, which is on page 11 of your board packet. And in this segment, we're talking about promoting improved health through policy change. As part of the TSET 5-year strategic plan, driving policy change has identified as a goal and major activities. One of the ways TSET educates on the benefits of policy change to improve health is through policy resolutions approved by this board, as well as toolkits, speaking engagements, and other opportunities for thought leadership. TSET is consistent in messaging the evidence-based benefits of policies to prevent and reduce tobacco use, efforts to prevent and reduce obesity, as well as educating on the deceptive marketing practices of the tobacco industry. In your packet are a few examples of the ways TSET meets this goal in educating on the merits of policy change. This past year, we saw Tobacco 21 made law at the federal level, and state law change followed. TSET continues to educate on areas where Oklahoma's laws do not support health, including the need for comprehensive clean air policies, health education and appropriate licensing, and taxation for vapor products. I now also want to announce that the performance evaluation for the executive director, that this is an annual evaluation, and we've come time where we're getting ready to do that. So over the next few weeks, we'll be reaching out for feedback from the board members to inform the performance evaluation of the executive director. And you'll be receiving an email from me advising on how to proceed with that effort. Now, for the third item under the this initial chairs component of the meeting, we have election of officers. 2 officers are up, chair and vice chair. The floor is now open for nominations for chair.
You get to do it again.
Sadly, the bylaws can I go ahead and nominate? Can I go ahead and make a nomination?
Yeah.
Yeah, I'd like to nominate Michelle.
Need a second.
A second for nomination.
Are there any other nominations? Discussion? Roll call.
Bruce Benjamin,
Yes.
Michelle Stevens,
Abstain.
Susanna Gattoni,
Yes.
Marshall Snipes.
Yes.
Okay. Now the chair is open to receive nominations for vice chair.
I nominate Bruce Benjamin to be vice chair.
I second that nomination.
Any other nominations? Discussion? Roll call.
Bruce Benjamin,
Abstain?
Michelle Stevens,
Yes.
Susanna Gattoni,
Yes.
Marshall Snipes.
Yes.
All right. Congratulations, Michelle.
Thank you.
All right. Item 4 on our agenda is the executive director's report. Julie.
Well, we've got our PowerPoint up, and so I would like just a moment of personal privilege to recognize some of the things that have happened under Bruce's chairmanship on this board. Of course, he became chair as the agency was in the process of doing an executive director search and hiring process, and he was headed that up. Under his tenure, we also developed a 5-year strategic plan, cohesive research metrics, leadership transition at the TSET Health Promotion Research Center, and they've recently added 3 new faculty. Under Bruce's time as chair, we have launched the TSET Healthy Youth Initiative, which is a 3-phase program to include My Life, My Quit, which is a teen tobacco cessation texting app. We've also awarded $3.4 million in incentive grants. We started and awarded the food access grant category in 2020 as COVID-19 was in the throes of it all. At the same time, TSET hosted the Southern Obesity Summit in Oklahoma City in 2019. The board has consistently supported efforts to train physicians through a partnership with OSU and also recruit doctors to rural and underserved areas with our partnership with the Physician Manpower Training Commission. The TSET board also adopted our first ever policy resolution supporting the reduction of childhood obesity and obesity overall. We wrapped up our healthy living program, which had over 1,000 tobacco-free policies passed and impacted 1.5 million Oklahomans, leveraging TSET dollars 3 to 1, in some cases more than that. We've also developed, launched, and awarded the next generation of healthy living program. And we've added 3 new staff positions, reduced our office space footprint, and realized facilities cost savings. And the smoking rate in Oklahoma is the lowest it's ever been at 18.9%. And on November 3rd, Oklahoma voters affirmed TSET structure with the rejection of State Question 814. So thank you for your service and your leadership.
Quick comment. Thank you for those kind words, but it's not really me. It was you and your staff and the other board directors, and I'd say it's been a privilege to work with everybody to help TSET move forward.
Very good. Well, we appreciate it. We know being chair takes time and brain power, so it really does make a difference to have your support. And then real quick, I have some comments under the executive director's report. In addition to that, we continue to do outreach via Zoom. We are all really great at Zoom right now, including speaking at virtual conferences. We will be participating in a national webinar later this week on tobacco industry efforts to influence policy. And we continue to serve on the TSET Health Promotion Center's Faculty Search Committee. Also, as legislative session begins next week, our staff has been reading bills and combing through them. At your place, there's a document that includes all of the bills that are of interest at this first blush. Bill filing was Friday. I draw your attention to a Senate Joint Resolution 13. It would reduce the amount of money coming into the endowment and use that funds for a new fund that would provide a incentive for people who file taxes in Oklahoma. And that's by Senator Rob Stanridge. Also, bill of note is House Bill 1893 by Representative Boatman, seeking to repeal language that prevents local municipalities from passing smoke-free policies. But the list is there for your review, and we'll provide an update in March or as this becomes relevant. But if you have any questions on that, let us know. Another highlight is that we recently had a paper that our evaluators did win a national award. The Oklahoma Tobacco Helpline article, They Came, But Will They Come Back? An observational study of re-enrollment predictors by Dr. Laura Beebe and her team, received the Michael P. O'Donnell Paper of the Year Award. The award is designed to honor some of health promotion's best scientists, in particular to recognize those who bring outstanding humanity to their field of inquiry and big-heartedness to their writing. The paper was published in the American Journal of Health Promotion and discusses how the helpline tries to innovate and remove barriers because most smokers can make multiple quit attempts before they are successful. And recent research showing it can be up to 30 quit attempts. The helpline is one of the top performing quit lines in the country. And what they were looking at is how the individual services, text, email, web, and a 2-week starter kit of NRT, how that impacted people's desire to quit. The hypothesis was that by offering individual services, that it would serve as a gateway to additional services for tobacco users, and some coming back for more. And what their research found is, yes, 16% of individual users re-enrolled for services within 6 months of that initial interaction, compared to only 3% who enrolled in the multiple call program. So letting people have control makes them feel that they can come back and do it again. And, this really furthers our research, furthers quitline research nationally, and keeps informing how we need to be dealing with the people that we seek to serve. At the same time, with this pandemic environment, we are seeing a slight decrease in registration volume for the helpline. Quitlines across the country are seeing this as a trend. Oklahoma is seeing about a 10% decrease in helpline registrations when we looked across the other states that our vendor works with, while other states are seeing a 22% decline. So we're keeping an eye on that. We have some meetings in the next couple of weeks to see what additional levers can be pushed. This is all while we know we have a very robust helpline promotion campaign going right now. So we will likely bring you an update on that in March, but just wanted to bring that to your attention. And we continue with our staffing succession planning. You'll notice that most of the meetings have included some hirings. We have several staff retirements that will happen here this calendar year. And so we are making those plans and trying to get folks on board before our institutional knowledge retires, and to keep our services running appropriately. Any questions?
All right, thank you, Julie. Now on our agenda, I'd like to move on to item 5, Programs Committee Report, which I'll be giving. The first item under this committee report, update and revision to impact modeling for health systems initiative grants. Dr. Laura Beebe and Heather Ross with the Hudson College of Public Health at the OU Health Science Center will discuss the prevention impact simulation model that's referred to as Prism and go over some of their recent results. Then Director of Program Jonas Mata will then add context on the results as compared to TSET's funding investment during the same period of health systems initiative work, that'd be FY15 to FY20. Dr. Beebe?
Good morning, everyone. My name's Heather Ross, and I'm part of the evaluation team for the Health Systems Initiative grants. And about 6 months ago, I presented some program highlights of the HSI grantees. And as part of that presentation, we showed results from Prism modeling, and those included projections of medical costs and lives saved as a result of each program. After that presentation, the evaluation team, in partnership with RTI, who created and maintains the Prism model, got together and we ran some additional analysis. And that analysis used different assumptions about the target population for each program. So I think these results are included in your packet, but before you review those, we wanted to walk you through some of the math and methods that are behind the analysis so that you have an understanding of why those outputs differ. So, as a quick recap, we use simulation models because they can project the potential long-term impact of disease prevention programs where other evaluation methods can't. And that's because the benefits of these programs can take many years to be realized. A unique feature of simulation models is that they can take into account the intent to treat nature of community-based prevention programs. And that means that when program reach is calculated, it includes everyone with access to an intervention and not just those who engage in or participate in the intervention directly. The Prism model in particular has been used by CDC to evaluate the impact of their community-based grants, and this approach is also used in the evaluation of TSET's Healthy Living program. Estimating the impact of community-based intervention in Prism is a 3-step process. So first, the intervention is converted into a Prism input. And that's done by multiplying the strength of the intervention, and that's obtained through a literature review, by the proportion of the target population reached by the intervention. And then this input is rounded to the nearest 0.01. Next, Prism uses that input to estimate the impact on outcomes of interest like per capita medical costs saved or deaths averted per capita. But what we really want to see is the total impact of the intervention across the target population. So the next step is to estimate the total impact by multiplying the per capita impact out across that target population. Next slide, please. So to quickly clarify, when I say target population, I'm referring to the community or the people that could theoretically be impacted by an intervention. And this graphic outlines the spectrum of assumptions that could be made about that target population. So the broadest assumption on the right, which is what we used in our first analysis, defined the target population as the state population. In the second analysis, we used the assumption with the most conservative definition, and that's only patients or employees in participating organizations. So together, these analyses really bookend the potential impact estimates. And it's important to note that the target population could fall between these two extremes if we apply different assumptions. So for example, you might define the target population for the Department of Mental Health program as all persons with a mental health diagnosis and not just those who are actively receiving care through an ODMH contracted site. All this to say that the choice of assumption impacts your results, and I'm going to walk you through an example of this on the next slide. So here we show two analyses of the same intervention, but with different assumptions about the target population. And I should note here that this is completely hypothetical and the numbers are not based on real data. The example on the left shows the conservative approach. So in this example, you have a smoking cessation program that is reaching 10,000 patients, and you've defined your target population as the 350,000 people who receive care at a hospital each year. So when you calculate your reach, you take that 10,000, divide it by 350,000, and you get 2.9%. You then multiply that by the intervention strength and get your input for the model, which comes out to be 0.01. That translates to a per capita impact on death of minus 0.01%. And so to get the total deaths averted, you multiply that out by your target population, and you end up with an estimate of 35 deaths averted. In the example on the right, we work with the broadest assumption of target population. So here, you still have 10,000 people being reached by your intervention, but you've defined your target population as the entire Oklahoma adult population, which we'll say is 3 million people. So you can see that your reach declines drastically. So instead of reaching 2.9%, you're reaching 0.3% of your target population. But when you multiply that by the intervention strength, you get a smaller number, a 0.001, but that gets rounded up to 0.01, which is the smallest change that the Prism model will input. And so when you get to your per capita impact on deaths, it's the same in using either assumption. So then when you multiply that back out over your target population, instead of 35 deaths averted, you would get an estimate of 300 deaths averted. And that's because of that rounding and because you have defined your target population, the potential people who could be impacted by the intervention, as a much larger group. So I hope that helps provide a little bit of a better idea of how Prism goes about making estimates and what impact and assumptions around target population can have. And if you have any questions, I'd be happy to try to address those.
Heather, I have one quick question, and that relates to the intervention strength. I know that you picked that number out of the literature. Is that kind of an Oklahoma-based number, or is that in a population comparable to Oklahoma, or let's say national?
The intervention strength is usually from national. The Prism model uses the same intervention strength regardless of where the intervention is taking place. So if we are working in Oklahoma on the same kinds of interventions that a CDC grant worked on, the intervention strength is the same. It's built into the model and it's consistent across. And it's based on effect size from literature.
Okay, thanks.
Mm-hmm.
Any other questions for Heather? All right, go ahead. Thank you.
Or not?
Yeah, so I would point you to page 25 of your packet. These are the results that Heather mentioned previously. And if you look at page 25, you're going to see, for example, at the very first page, you'll see the Oklahoma Hospital Association. That projection was presented to us back in August by Heather, and I would consider that the broadest projection. And then the conservative projection is just below it, which she provided to the program committee in January. We were very interested in looking at not only, death averted and medical costs and lives saved, that kind of thing, but also our investment. And I can tell you that this model is a 10-year projection model. It covers years 2015 through 2025. When I looked at the entirety of this, total deaths diverted across our three HSI grantees, which are the Oklahoma Hospital Association, the Oklahoma Healthcare Authority, and the Oklahoma Department of Mental Health and Substance Abuse Services. Total deaths averted were 417. Total medical costs, and this is on the conservative estimate, were total medical costs saved were 47,831,000. And then the number of fewer smokers is 10,591, and that's strictly the Oklahoma Healthcare Authority. So the total TSET investment during the same period of time would be 8.6 million, which is really a ratio of for every TSET dollar, there's $5.55 being saved overall. And so as you look at page 25, I provided some figures per each of the HSI grantees. For example, under the current results, January 2021, you'll see that medical cost saved were 27.3, and our investment was 3.9 with a ratio of 6.85. And then on page 26, you'll see the same done for the Oklahoma Healthcare Authority. They're under the current results, conservative results, and then for the mental health and substance abuse services. So I think it's important to note that our investments have really had an impact, not only in terms of lives saved and number of fewer smokers, but also in terms of medical costs.
Any questions for Hona? These numbers are important because it does tell us where we are having impact, and it was important for us to have this group come back and kind of talk through their work and give you guys any opportunity to ask questions, but also to see that impact modeling. All right.
Okay, thank you. The next item on the agenda is discussion and possible action on FY 2020-22 grant renewal. And this is in reference to Oklahoma Healthcare Authority, Oklahoma Hospital Association, and the Oklahoma Department of Mental Health and Substance Abuse Services. June 2021 marks the end of the current funding agreement between TSET and the three health system initiative grants. During the August board meeting, the board was presented with the historical achievements of the HSI grantees, and in November, the board received a summary of potential future directions for each of the grantees. CONOS will review the funding options for board consideration.
Yes, if you look on page 27 of your packet, we have just a summary there, and there are two funding options. These group of grantees are in their final year, and they're eligible for what we call continuation funding, which is it's a 3-year cycle. And as we thought about it, and given the COVID environment and the impact it's having on each of them, really trying to meet their objectives and their action plans for this year, we decided that there might be a second objective, which would be to do a continuation for 1 year while we really take a solid look, not only internally here in the state, but across the nation at what other similar agencies are doing, and then come back with a game plan for each of them, working with them, but certainly working with experts also at what might be possible. Because I think the COVID environment, in terms of outreach that these agencies have had, has really dampened that. And so we're looking for new strategies for them to implement. And as well for the Oklahoma Healthcare Authority, you've got the Medicaid expansion that we're also trying to figure out what the impact of that will be. So our recommendation, the program committee's recommendation and staff's recommendation is that these grantees be approved for a 1-year renewal grant, which will allow us planning time to accommodate the changing environment.
All right, thank you, Jonas. Let me repeat the last statement that Jonas said, just for clarity. The board's program committee and TSET staff recommend the HSI grantees be approved for a 1-year renewal grant. That recommendation came out of the program committee and does not require a second. Any discussion?
So this is the same problem we had last year. We're approving spending money for the next fiscal year without consideration of the impact this has on our overall budget. So I'll be voting no.
Okay. Any other discussion? Roll call.
Bruce Benjamin,
Yes.
Michelle Stevens,
Yes.
Susanna Gattoni.
Yes.
Marshall Snipes.
No.
So point of clarification that the budget scenarios that you've seen in your packet do include this as planning. As we move forward with that budget process, we do highlight what we anticipate to be the expenditures when we're giving budget scenarios, obviously noting that that will take board action to approve this. So as the vote stands now, this grant will end. Or we can revisit this after March when we have additional information on the fiscal year earnings in the budget scenario. Are any of those options amenable?
Well, I think we did the same thing last year. It's been approved today.
No.
We have a quorum of 4 votes, and you need a quorum to pass forward with a funding decision.
But what did we just vote on?
We're voted on a 1-year extension.
So we voted to spend money.
The
4 out of 7.
The motion failed.
What?
Motion
The
failed.
motion failed.
It's a 4 vote.
Oh, okay. I'm sorry.
So if you would like, we could amend the motion to say pending available funding, which is always a criteria that we have. If
Well, I think what we did last year was we told all these folks that it was management's intention to move forward subject to the approval in the budget process. That was my understanding.
So their funding term ends this fiscal year. So if this is the wishes of the board, then these grants will end July 1.
Right.
At the start of next fiscal year. So unfortunately, we have a very tight quorum since we have folks absent. So the quorum vote is 4. The motion fails without having a total of 4.
So is the quorum based on who's here or based on the total?
You have a statute that says you have to have a 4 vote specifically, or is it just normally, if there's nothing in the statute, it's the majority of the quorum present. So you have a quorum present. A quorum is 4. There's 4 people present, and the majority vote has been 3
That's what I understood.
to 1.
If that is your guidance, we will take it. You
Well,
are the attorney.
I'm saying that not knowing what your statutes are, and not having them in front of me to look at.
It is, let me
And
look.
I can pull it up on my.
Yeah.
was thinking that it was of members present.
Mhm.
My assumption was it passed. 3-1.
We will get clarity because there are several other decisions that need to be made further down the agenda. So, I don't know if you'd like to take a 5-minute break that will allow us to get that.
If we have other votes coming up, I think we should understand our situation.
Mhm.
So, do we have to vote on a recess?
No.
I'd like us to take a 5-minute recess while we get clarification on the vote issue.
Do you have a printed copy of your statute that I can look at? I'm trying to search in on my phone and it's hard to read and find.
the rest, so let me adjust. Okay, so we had comments that people were having trouble hearing. How are you able to hear right now?
Okay. Okay. Can you test on, you're good, Jack? Can you hear Sandra? I'll get closer to this one.
And then Martha, you might just have to talk up to the folks following
You're,
along.
yeah, you're same problem as I do. You're in between the microphone.
Okay, Tessa
This
says,
is Anna. We seem to be able to hear everyone now.
Okay.
all right, thank you. All right.
All right. I'd like to bring the meeting out of recess. So we're good now. Okay, we just had a discussion and gotten a legal opinion on what constitutes a yes vote, and I would like to have Sandra give us her opinion.
So a review of the board statutes and rules indicates that there is nothing that specifically establishes what number of votes is required to pass a measure. So in the absence of that language, the default rule is generally a majority of the quorum present is required to pass a measure. And so in this particular case, the vote was 3 in favor, 1 against. So 3 is a majority of the quorum of 4. So the measure would pass.
All right, thank you. So the measure passes. All right, now for the next item on the agenda. Discussion and possible action on proposals for youth advocacy program. This is in reference to Rescue. As requested by the TSET Board of Directors, Rescue has submitted to TSET a proposal for the development, implementation, and management of a statewide youth advocacy and education program in Oklahoma. Director of Grants Management, Tessa North, will review the process used, and Honas will address the content of the proposal. Tessa?
Great, thank you, Dr. Benjamin. So in November, at the mid-November, we started to develop the guidelines for the youth advocacy program that we wanted to see. As a team, we worked on getting those all together, and then at the end of November, we issued those guidelines to the potential vendor that the board had previously approved, which was had approved submitting a proposal, which was Rescue out of California. So Rescue took a couple of weeks to review the guidelines, and then we asked that they submit a draft proposal to us. They submitted a draft. An internal team of reviewers and some external reviewers took a look at it. We offered some comments and some feedback. We sent those comments to Rescue, and they had a couple more weeks to address them, ask any clarifying questions of us, and then they submitted to us on January 6th a final proposal, and that was what was presented to the programs committee. So the final proposal was reviewed again internally by staff, and we as staff felt that it met the requirements of the board. It met the goals of TSET in terms of this program, and so we presented that to the programs committee, who I believe their recommendation was to accept. But Honas?
Yes, I'll point you to page 29. That's where the summary begins, and I'm not going to go through the summary itself. I'll just give you some highlights. The program has 2 main components. Obviously, it's engaging high school students, and then those students will get involved in education and policy change through some youth-led activities. Rescue proposes to partner with existing high school clubs, so they're not trying to create new ones, and they do that through subcontracts of $2,000 per year, and that money doesn't flow until specific projects are completed by the students. They'd like to recruit 40 clubs across the state, which is one of our requirements, and up to 1,000 high school students really involved across tobacco prevention, physical activity, and nutrition education activities. The very first year is really, first year from March through September is really about planning and getting folks on board. And then they'll also be recruiting clubs. But they feel like by the end of the second year, they'll be able to have a statewide leadership team of those students that excel in the work that they're doing. And we're going to come together to agree on the policy change focus. You will notice that on page 19 of your packet, not that I expect you to go back there, but that's where we listed our tobacco control policy initiatives. And of course, we've got our resolutions around physical activity and nutrition, from which, you know, we'll choose some of these initiatives. They will develop with us measures of progress, or metrics as they're called. We fully intend to evaluate them by an external evaluator. They have their own evaluation plan, but they've agreed to also be externally evaluated. As the PowerPoint shows, we're looking at youth advocacy and education. Funding March 1st through June 30th would be $332,000, and then FY22 through FY25 would be a matter of $1 million per year. Any questions?
All right, thank you, Hannah. So let me see if I can repeat. The work program staff recommends approval of the agreement in the amount of $232,000 for the remainder of FY21. And it is March 1st through June 30th, 2021. Renewal for up to 4 additional years based on funds available and contractor performance. Years FY22 through FY25 are recommended to not exceed $1 million per year. Again, this is a recommendation from the program committee. It does not require a second. And just as a reminder for everybody, of the quorum of the board is one person. Yes vote requires 3 yes votes for this. Any discussion? We break this into motions, one for the current year, 332,000, and one for the. That be good.
My understanding, we are only approving the 232,000.
Correct. It is meant to be a multi-year program, and we renew our contract. Looking at the budget for next year is that they are building the next year for activities that they will carry out in those other years.
We'll also be evaluating them for their like done not their cookie cutter way they've done another.
Correct. So not
I'm sorry, we can hardly hear you all. It's barely a mutter now.
Okay, I'll try to talk louder. Can you hear me now? I said it was my understanding that in terms of the contract, whatever will be entered into, is that there would be requirements of a review, as we just spoke about today, and that then it would have to be renewed again because it's a state contract, and I don't think that we can necessarily enter into anything for more than a year. I'm not the lawyer here, but that's my understanding. I don't know if that's helpful.
And Marshall, I think they have been made aware that we are looking at this very carefully, and we want to be sure that it's meeting our needs.
Yeah, we're going to approve the $332,000 the finance committee budget to revise this budget. My objection.
I'm still having quite a bit of difficulty hearing.
technology.
Okay, is this any better? Marshall, can you hear me?
Not really.
Okay, that seems to be looking the best. Can you hear me? I don't know what to tell you.
Yeah, you guys are very faint.
Down there in fact, I just those microphones are muted.
Maybe look at your master volume as well.
Try again. Hello, hello?
He's tried both with no luck.
They don't want to hear me.
Push. There's a little.
Now we can hear you guys much clearer.
Okay, we will use our best voices to project. Can you hear? Test on Marshall, please.
Hello?
Marshall's really good. Julie, we can hardly hear you.
You can't get everything you want. Can you hear me now?
Yes, we can hear you now.
Still trying to get through this. Thank you.
Okay. Let's re-zero for just a second. So we have a proposal in front of us for continuation of funding to the tune of $332,000 for the remainder of FY21. And then it's renewable for up to 4 additional years based on funds available and contractor performance. So we're not voting on 1 million per year renewal right now. That's contingent on other factors.
So can we just leave it out? Just vote on the 332? We're not voting on, why do we need to vote on the future? I don't understand.
We're showing intent to the company. It's not a commitment.
Well, maybe we should have had the finance report first. I'm not comfortable that we know what the budget's going to be for next year, total budget. And it appears to me and to the finance group that we're not going to have as much money as we've had in the past. Therefore, we're going to have to cut. And this body, this board has not made any decisions about where we're going to cut. It's very possible we could cut some of these programs that we're giving people indications that we're going to do it. For example, the last vote we just had, we had 3 other agencies that now expect to get, we're going to tell them they're going to get money subject to whatever. We may have to go back to them and say, you're not going to get anything, or you're going to get something significantly less. I'm just trying to avoid that, because we don't know what the budget's going to be, and we won't know until later in the spring.
So when I listen to you, I hear you say our decisions are going to be based on funds that are available, and we'll have to figure it out. And that's what the motion says, what you just said.
Yeah, it's very clear, and it's clear to our potential vendors that it is based upon funds available, and the board is the one that will interpret that on a year-to-year basis, as well as the contractor performance.
Well, I think we all know when we tell them this, they're going to expect it.
Usually it's contract, almost always contract budget.
subject to funding.
We can't hear the discussion at all again.
Can you hear me now?
I can hear Julie.
Great. So any indication in this meeting helps us move forward with planning for the next fiscal year and indicates the board's priorities. Our contracts are always subject to available funds, and every vendor, every contractor understands, especially those that are state agencies, that work just based on available funds.
Marshall, I appreciate your concern. I feel like the motion as it stands addresses what you're concerned about. Any other comments on the discussion? Roll call.
Benjamin?
Yes.
Bill Stevens? Yes. Anna Gattoni? Yes.
Okay, motion passed.
Can you guys repeat that? We could not hear what Bruce said.
Okay, a motion passes. I'm changing my position.
Sometimes there are microphone systems like this where if more than a certain number of microphones are on at the same time, other ones don't work. I don't know if that's part of the situation that you're facing today.
You're now getting some distorted feedback as you speak.
So normally you would only turn your microphone on if you're going to speak.
Oh, so we should turn these off?
I don't
know. We have not had to do that in the past. So
let's all turn off. Okay, can you hear me now? Back?
Yes.
Okay, great.
And no feedback, so much better.
All right. We may have our technology straightened out here. The motion passed with a vote of 3 in favor and 1 opposed. Now we'd like to move on to the next item on the agenda, discussion and possible action on emerging opportunity grant. This is Build Environment, Oklahoma Department of Transportation. TSET staff have been discussing various ways to swiftly launch in and distribute a portion of the Emerging Opportunity Grant Program, that's $420,000, to fund best practices and approaches that have been approved by the board of TSET to fund in FY21. Jonas will discuss the process and recommend projects. Jonas.
Okay, if you'll go to page 36 of your packet, just as a reminder, in the last year and a half or so, we proposed to you three different types of project: innovation in policy and practice, spur the growth, and that was about getting people to move and eat better, and then and incubate systems change. We're now just dealing with one of those programs, which is the innovative policy and practice. And the funding allocated, there are $420,000 allocated in FY21 to do that. And so we were looking at options for moving that money out the door. And one option is that we put together guidelines, which we have done, and then request proposals. Another option is that we work with a trusted partner that has already vetted some projects, and that we pursue that. And that's what you've got before you. We've talked to the Department of Transportation, who also works with us in our incentive grant programs around the built environment, and certainly are very willing to work with cities in adopting policies around tobacco-free environments and wellness. And so we've spoken with them off and on, and they came back with 41 grant opportunities. And so I asked them, of those opportunities, how many could start construction and get quite a bit of it done by the time that FY21 ends, because those are the monies that we have. And they came back with 4 programs. And if you look at your packet on page 37, we list those programs. There's one in Stevens County, one in Woods, Texas, and Oklahoma County. So there's the towns of Comanche, Winoka, Texoma, and Jones. And what we tried to illustrate in this table is the support that's available. So you'll see a column for local support, our support, federal support, and then what the total cost is. And then the additional funds that are needed. What I need to say is that even though there are additional funds needed, even with our support, there's still construction that can be done. There's still streetscapes and sidewalks and crosswalks that can be built. And so these are the projects that are doable in FY21, this fiscal year. I tried to give you just a couple of sentences about each of them there on pages 38 and 39. And so that's what we're bringing before you for consideration. Any questions?
Can you hear me?
Yes.
On the schedule, it says 460 in our voting.
Right. We'll adjust that to 420. That's probably my mistake. I saw it before. I didn't get a chance to adjust it, but though we can make those adjustments. So it's 420,000.
Thank you.
Any other questions? This is a recommendation from the program committee, and it's for $420,000. Any further discussion? Roll call. Yes. All right, the motion passes.
We did not hear the vote.
Okay, the vote was unanimous of the board members present, and the motion passes. The next item on the agenda is Public Information Outreach Committee report that would normally be given by Casey Kilblain. Since she's absent, I'll be giving that report. First item, discuss and possible action on health communication FY 2021 budget. This committee is recommending $575,000 budget increase to the health communication budget to be used to replenish funds used over the holidays to support a $500,000 campaign partnership with the State Department of Health and the Governor's Office to encourage Oklahomans to follow risk mitigation efforts for COVID-19. Funds that were budgeted for the Tobacco Stops With Me were available to be quickly put to use for the urgent COVID-19 campaign. However, additional funds are needed to ensure Tobacco Stops With Me meets program goals. In addition, we are recommending a subcontract through VI Marketing and branding for public affairs and public relations services from Saxon, an approved statewide vendor for public relations work. The increase is recommended from the Public Information and Outreach Committee. This recommendation is Their motion is up for discussion. Does not require a second. Roll call. Yes.
Yes.
Abstain.
I also voted yes. I forgot to have my mic on for that.
Okay, the motion passes 3-1. 3-0-1, correct. Thank you. Excellent. All right. Second item on the Public Information Outreach Committee report is Health Communication Update. The health communication information begins, it's about page 36 in your board packet. All brands are performing to plan. TSET's partnership with Oklahoma State Department of Health to support a campaign for risk mitigation for COVID-19 began airing in late December and ran through the week of January 18th. A final performance report will be available by the end of January, but a midpoint review shows we were getting our expected due rate for the $500,000 plan. Our outgoing partnerships have helped with TSET message outreach, and we will be calling on our OU, OSU, Healthy Schools OK Oklahoma partnerships to create fun nutrition and physical activity messaging for spring break in March. The Helpline website makeover continues with phase 2 of okhelpline.com. The updated website will allow us to follow up with website visitors who didn't complete sign-up. Other changes include testimonial blogs, additional Spanish language options, updates to interactive quizzes, a media room refresh, and an easier way to order materials. For Tobacco Stops With Me videos that explain the impact of policy change are being created. We are placing Tobacco Stops With Me defenseless messaging on TVs and doctors' offices in 119 locations across the state. We are expecting a presentation on the evaluation of Tobacco Stops With Me and Shape Your Future 2020 cross-sectional report by Dr. Laura Beebe this spring. Shape Your Future released its obesity policy toolkit on the website in January and shared it with partners and grantees across the state. Commercials that support improved sleep messaging is currently in rotation, and the sugar-sweetened beverage messages will be shown in digital and social placement the fourth quarter. Shape Your Future educational signage launched in rural and in laundromats, grocery stores, and low-income housing in counties that have higher rates of obesity. This messaging will be in 102 locations in 48 counties. Each year, these have been well received with positive feedback from location managers and patrons. All right. Third item, Public Health Academy of Oklahoma update. We have seen more than 150% uptick in grantee posts between November 2019 and 2020. Since July, we have posted nearly 60 trainings and have an average of 117 users accessing the site each month. Fourth item under this committee report, TSET Healthy Youth Initiative update. The My Life, My Quit promotion to teens began in December with more than 300 visits to the website reported. As this is the first large promotion, this is a good bump in unique visits, and we expect to see the number continue to grow even though the pandemic has affected school attendance and slowed promotional plans. The nutrition campaign production is in full swing with a launch date expected the week of February 8th. Oklahoma Youth helped select the name and logo of SWAPA as an aspirational goal to make better food choices. The lighthearted or humorous campaign messages will focus on how teens can make better food choices through small changes that will help them perform better at school and during physical activity. Both of these ideas were supported by Oklahoma teens in message testing, along with the idea that teens do not think their eating habits do need and can change for the better. Tobacco messaging packages focusing on vaping in urban areas and smokeless tobacco in rural areas will be seen in the fourth quarter.
Yeah, just a clarification on that. All right. Clarification on that is that the teens do think that their eating habits need to change and can change, which shows that the environment or the folks that we're messaging to are receptive to the message. So
thank you, Julie.
I have a question about that last sentence about tobacco packaging focusing on vape in urban areas and smokeless tobacco in rural areas. I think that is a mistake not to be focusing on vaping in the rural areas. Smokeless tobacco is what it is in rural areas, but vaping is as bad or worse in rural areas, and I really don't want those teens to not be hearing that message as strongly as the urban kids are. It's easier, and even the, quote, good kids who are not substance abusers are vaping in those communities.
Okay, thank you, Michelle.
thank you.
So are we changing that?
Can we, there's no action item, but can we have some sort of influence on that as to how they're marketing, since it's still in the
Yes, we certainly can. The vape message would still be carried on radio across all of Oklahoma, which would include urban and rural. The smokeless message was going to be pushed on digital and social. We can look at switching back to doing the vape messaging for rural as well. For social and digital.
I would really like for that to happen. And radio messaging to teens, unless you're doing Pandora and all of those other sorts of options, I don't think you're going to reach a large number. And I do want to see the vaping message as strongly in the rural areas.
I would agree with Michelle.
We can look at changing that messaging for the fourth quarter.
Just one other question. What does that mean radio-wise? Does it include those internet subscription places, or is it just our traditional radio that's of fossils like those in our room listen to?
Some of the traditional radio that we do is really about raising awareness of, as you say, of fossils, so that we're aware of the messaging that the children that the youth are seeing. So the traditional messaging, like on television and radio, that we do to support the social and digital messaging that is done, is really to make parents and grandparents and adults aware of the problem and the information being given to teens, so that when they have conversations or teens ask questions, the parents and grandparents are as educated about the topic as teens are, so that they can engage in those conversations. So that's really how radio and television support our youth campaign. You're welcome.
All I had to get myself relocated where we were. Item E, outreach update. TSET paid media performance. The board packet has performance data on the most recent TSET brand paid media flight, which ran from 10/12 through 11/22. Messaging was prioritized to convey TSET's work in prevention to help Oklahomans live longer, healthier lives. One group of messages focused on the behaviors that led to poor health outcomes and premature death, while highlighting TSET programs that improve our state's health. The second message focused on TSET's history and its commitment to keeping the promise to Oklahoma voters. Earned media performance. In FY21, the second quarter, TSET PIO prepared and distributed 10 statewide and local press releases. Those press releases were extended by local and state publishers at least 70 times. Next item, TSET.ok Gov Migration. As the new statewide branding rolled out in FY20, state agencies are being asked to migrate their web presence to the state's new Adobe-based platform. TSET has been planning for a new website to make online content easier to find, provide a mobile-friendly web experience, and more interactive functionality, such as our local impact pages. TSET is working with OHMS to plan our migration to the Adobe platform in the first quarter of FY22. Legislative pages. Every year, TSET provides public data to legislators reporting on local health outcomes for each county and district. It's anticipated that local impact pages will be ready for the legislative session. All right, TSET FY20 annual report. The TSET annual report is in production with an anticipated completion date of January 29 before the beginning of the legislation session. The report will highlight TSET accomplishments for FY20 and outline the budget and expenditures for that year. Highlights from FY20 include the second round of TSET Healthy Living Program grants awarded to 35 organizations serving 37 counties. $1 million invested in food system impact grants to reduce food insecurity and prevent hunger. TSET launched a Healthy Youth Initiative aimed at helping teens prevent tobacco use and obesity. And then finally, TSET hosted the Southern Obesity Summit in Oklahoma City, bringing hundreds of people to learn best practices about encouraging healthy habits and preventing obesity in their communities. Now, newsletter and media clips. The packet also includes information on the TSET newsletter performance and selected media clips from around the state. The next item under this committee report is sponsorships. TSET has approved 6 sponsorship grants so far this year, amounting to $7,500 or 31.25% of this year's sponsorship budget. Most of these events are virtual. And then the final item on this committee report, upcoming events and training. Upcoming events include the State Chamber's legislative reception on February 21, 2021, the Society for Research in Nicotine and Tobacco's annual meeting. This will be a virtual meeting. February 24 to 27, and the Tribal Public Health Conference in April. You'll also see a full list of legislative deadlines for the 2021 session, which begins in February 1 in your packet. All right, that concludes the report from the Public Information Outreach Committee. Item 7 on our agenda, Agency Operations Committee report. Marshall.
We can't hear if Marshall's speaking.
But at any rate, the fiscal year 20 budget has now almost been closed out. There's still a few invoices that are out there, and you can see that we were at a 91% spend rate for the operational budget and a 92% spend rate on the program budget. And as I mentioned, some of that is due to lack of final invoices. But in any event, we will have an anticipated 3.7 million that'll go into our board of directors reserve for the future. With respect to the current year, you can see that we are on target in our operating budget at a 38% rate, and that we're a little low on our program budget at 25%. I think the pandemic has had some impact on that, but the management is working on dealing with the programs and trying to get that back under control. The next item is the budget revisions, and we've already talked about all two of these items, and we have approved those. So, Mr. Chairman, do we need to pause here and vote to revise the budget?
Yes.
So I would propose a motion to approve the budget revisions that we previously discussed, which were the $332,000 for the Youth Advocacy and Education Program and the $575,000 increase to the V1 contract for health communications.
All right, thank you, Marshall. This motion came out of the committee, does not require a second. It's now open for discussion. In the absence of discussion, roll call. Yes.
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 The motion passes.
Okay. Thank you. You've also got in your packet what we call the current commitments for the future, and that I think we've discussed that enough today. Fiscal year 22 budget. As I mentioned earlier, we do not know what the earnings are going to be for the current year yet. We were hopeful to have some of that information before this board meeting, but we did not get it from the Board of Investors. So we will defer that discussion until our May meeting, but just to kind of put everybody on notice, our expectation is that we're going to have significantly less money to spend in fiscal year 23, and that will impact our fiscal year 22 thinking when we go through that process in our next board meeting. So we will be working between now and the next board meeting to understand the impact of the current year earnings on the future budget process, and we'll have a detailed report in the May board meeting. Mr. Chairman, that concludes my report.
All right, thank you, Marshall. The next item on the agenda is entering executive session, and I would like to consider a motion and a vote to enter into executive session, referring to 25 OS 307B1 to discuss candidates for program officer.
So moved.
Second.
Been moved and seconded. Roll call. Yes.
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 Motion passes. We'll now enter executive Are we live again? All right. The chair now is open for consideration of a motion and a vote to return to open session.
I move that we return out of executive session into open session.
Moved and seconded, roll call? Yes.
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 Yes. All right, we are now back in session. I would now like to have a discussion and possible action on the appointment of program officer. Julie, can you give us a recommendation?
Yes, it is our recommendation that we move forward with candidate A, directing our director of programs to make an offer of employment to candidate A at $56,000 per year. This is already budgeted, and if candidate, that's move on to candidate B and C. All right, what's that? All right, I will make that recommendation again. Thumbs up if you can hear me. Awesome, thank you, ma'am. Repeating the recommendation, it is my recommendation, staff's recommendation, that we move forward to direct the director of programs to make an offer of employment to candidate A at $56,000 per year. This is a budgeted salary. If candidate A is unable to accept employment, we move on to candidate B and candidate C.
So moved.
Second.
Roll call. Yes.
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 All right, motion passes. Yeah. Next item on the agenda is new business. Any matter not known about or which could not have been reasonably foreseen prior to the time of posting the agenda. Is there any new business?
Can I comment here though?
Is he allowed to make a comment under new business? No,
No.
you can't, Jack.
Okay.
You know how painful this is.
Oh. In absence of new business, Chair will entertain a motion to adjourn. Second? Is there a second?
Second.
Well, we have a motion and a second to adjourn. Roll call. Yes.
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 Yes. Motion passes. We are adjourned.
See you, kids.
Bye.